Welcome back, everybody. You know, they seem like superheroes to us, but when it comes to pain, ours is the same as any member of the Green Bay Packers, like Mike Daniels, who's here with us this morning. Good morning to you.
Good morning. Thanks for having me.
All right, the real superhero, though, might be Dr. Curt Draeger of Integrated Pain Solutions. Thank you for joining us.
It's nice to be here. Thank you.
Well, let's talk a little bit about treating pain. You've talked a lot about treating the Packers, but that's just one of the groups who you can help. Talk about how the everyday person can benefit just the same.
Well, pain is pain no matter what. And the bottom line is, let's say Mike injured his elbow or anybody injured their knee, shoulder. Less than 24 hours after that injury, scar tissue starts to form. Now, if I dissect out a 50-cent piece size of scar tissue and then a 50-cent piece size of regular tissue, I'll have 100 pain nerve endings in the scar tissue and 1 in the regular tissue. So there's a ton more pain nerve endings. So you have to treat not only that area that's injured, but then those pain nerve endings plug back into the spine. And where they plug into the spine in this little bump right here, that's a train track switching station. Your pain becomes memorized there. And that can happen in a matter of months.
Okay.
And so even if you fix this elbow, shoulder, knee, hip, wherever it was injured, if this chronic pain memory stays there, that tells those muscles to go back the same way they were before. And that's the ugly cycle of chronic pain. So when I treat it, I laser all these little bumps or in train track switching stations, so I erase the pain there. And then we erase it where all those 100 scar tissue fibers of tons of pain nerve endings are. So you have to treat both areas, and it doesn't matter where it is. The bottom line is you got to treat where it goes into the spine and where the injury is.
So, Mike, let's talk a little bit about your journey with Dr. Curt. What brought you to see him in the first place?
Well, oddly enough, it was an injury that I would like to think it was a football related, but clearly it was. I was taking my son to school, and as I was putting his car seat in the car, my back just threw out and I fell in the snow. I couldn't move. So I had actually gotten a text from Aaron. Roger, his dad texted me, and he said, hey, there's a great chiropractor in town, Dr. Curt Draeger. He's right up the street from the stadium. Go and check him out, and he'll take care of you. So when I went to see Dr. Curt, I went from not being able to move to running stride for stride with the wide receiver that runs so much faster than me. He was probably about 130 pounds lighter than me, but Dr. Curt had me feeling so rejuvenated that I was doing things I didn't even think was possible.
Now, we were just looking at video of the laser.
Yes.
Did you go through one of those laser sessions?
I try to get him the laser as much as I possibly can.
What is a session like? What can people expect when they're having that?
Well, you can expect a lot of jokes that are so bad they're good. Dr. Curt.
Thanks.
I get a lot of great quips from this guy, so that's part of the healing process. You keep the atmosphere light, so expect that. But you know, after he takes care of you, he'll tell you, instruct his assistants on where the laser should be applied, and you'll lay on the treatment table in whatever position is comfortable for you, and they'll have they'll turn the laser on and have it aimed at the area the area of trauma.
And it's painless?
Oh, it depends. it can get a little hot, to say the least, but it's actually pretty warm, it's pretty soothing, and I enjoy it. I try to get on there as much as I possibly can throughout the week.
And Dr. Draeger, it's also drug-free, which is really important to a lot of people.
Yes, it is, because these guys, you know, if they take too much of the medication, you know, it's going to affect their liver and kidneys. And over a course of a lifetime of beating for a lot of people, whether it be, you know, football or non-football, the kidney and liver has to detoxify all those different medications.
So I want to talk a little bit about, you know, you're treating these guys who are rough and tumble, you know, hitting each other on the field, but you're also helpful to weekend warriors or moms or dads or grandparents who just want to pick up their kids, right? Talk a little bit about who you can help with the laser treatment.
My main group of patients that I treat are in their late 60s and early 70s. They've had 4 or 5 surgeries, and they just can't get rid of the pain. And so when surgeries aren't going to help them anymore. So then when I'm able to treat a big area with the laser, I can erase usually 80 to 90% of that pain. And all I want for them is their quality of life back, because that's what they want. And ultimately, it's not about getting full function back, because that's impossible. My laser will fix any cell that's still alive. I can't fix a cell that's dead and gone. But what's really interesting now is with the latest research coming out, we're actually able to stimulate with our latest lasers that go super deep, you know, like they'll go a foot deep almost. We're able to stimulate now stem cells out of the bone marrow.
Oh, wow.
And so the stem cells will actually literally become the tissue that you want it to become instantly. You don't have to wait 30, 90 days. It instantly becomes that tissue. In fact, we use that same technology to help Jared Cook come back from his fibular head fracture much faster than he normally would have. And so this treatment is always getting better. I can guarantee you in 6 months I'll have something. I was telling Mike about it. I'll have new stuff coming out all the time. And what's nice is I get to treat Olympic athletes, and Olympic athletes, they do 12 events a decathlon. So I can measure how good the equipment is by how high they jump, how much faster they are in the running. And for these gladiator guys, I want them to have quality of life on the field and off the field to play with their kids. That's my goal.
To put those car seats in the car.
That's right.
Absolutely.
It can be a struggle, we feel you.
Exactly.
All right, for more information on a no-cost consultation, you can get in touch with Integrated Pain Solutions by calling 920-569-2350.
As I mentioned, they're right here on Cormier Road in the Green Bay area, or you can call toll-free 844-200-7246. Dr. Curt, thank you. And Mike, can't wait to, training camp's just a few months away now, right?
It's only a few months away. The countdown starts.